Hi, all. Thanks so much for watching Making Healthcare Work for You, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta. And today we're welcoming Kenzie Butera Davis, who is the founder and CEO of Maro, a children's mental health organization. Thanks so much for being here.
Thank you for having me.
For our one question, we're going to toss it to Apoorv because he has a great one today.
Thank you. I appreciate that, Stephanie. Yes, I was so touched by, Kenzie, your story. Your personal story. Thank you for sharing that so openly with us and your family stories. It must be really, really difficult to go through all of that. And grateful that you're bringing it to us. I really appreciated what you had to say about your solution being able to help with equity issues. And you also commented about how ultimately you're trying to help build a sense of community around the children that you're trying to help. So it made me think from the work that I'm doing right now in health equity and community building. I know you're a tech company startup CEO, but at the same time, you seem to have a very deep bent for social activism and really thinking about this so holistically. So are you in any position, with your company or perhaps with partnerships you may be creating to try to create a community around the schools to support these kids so that they feel that they're, better able to handle all the challenges that are coming up?
I love this question. And I'm smiling because I'm picturing in my head, we have this chart in our, I use it in our customer decks, I use it in our pitch decks, and it has the little Maro logo at the center of this ecosystem where schools, families, and providers are all connected. And I think community is if we can drive community and if we can help communities work more effectively together to address mental health challenges, then we've absolutely won. And what I heard I have talked to a lot of pediatric hospitalists. Our chief medical officer is a pediatric hospitalist. And what I continue to hear over and over is communications with schools is such a black hole in pediatrics. That's the phrasing that I hear repeatedly. And I think that if you can solve challenges around consent and screening and early identification and looping in the family from the school, you can sort of lubricate those relationships between the schools and the health systems. And of course, the families being sort of the central part of that. So it's very much always top of mind. And I also think when one of those pieces is missing, a child's having a hard time at school or a child has a really difficult home environment, there are opportunities to fill gaps when you have the community involved.
Wow.
I'm going to add on real quick, just because I think it's relevant how you named Maro, what it means, because it really does speak still to that community element.
Yes. So Maro is the last name of Virgil, the Roman poet, who appears as a guide for Dante throughout the Inferno, Purgatorio, and sort of releases him into Paradiso. And the analogy there is Maro is intended to be a guide through the hardest parts of growing up.
It's amazing. I love that. I love your mission. You're doing fantastic work, and I can't wait to continue to see what you're doing. Thank you.
Thank you so much.
Yes, thank you, Kenzie. I actually feel very hopeful, by this conversation. So thank you for bringing this to us, and best of luck to you.
Thank you all for watching. We'll talk to you soon. Bye-bye.